Good afternoon, everyone, and thank you for coming. We're going to talk a little bit today about the strategic plan for the Centers for Medicare and Medicaid Quality Improvement Organization Opioid Stewardship Initiative. First, I want to set the stage a little bit about talking about the opioid crisis. Most folks are aware there's a crisis, but I want to focus on how it's impacting our patients, their families, and the providers that have to care for the patients with pain. Currently, a third of the adults in the United States use prescription opioids. And the United States actually prescribes more than 80% of the world's opioids. That all kind of works together to speak to the culture of opioid prescribing and prescribing patterns in the United States as a whole. Drug overdose is now the leading cause of death in people 50 years of age and younger. The next statistic is actually really surprising to most folks. Medicare beneficiaries are currently the largest growing population being diagnosed with opioid misuse disorder. So as our baby boomers are aging, they're coming to our providers with complaints of chronic pain. And speaking of that culture, we prescribe. We've also had literature searches that show that 80% of heroin users first misuse prescription opioids. So it was either prescribed to them or through diversion, they got the opioids from someone else. So CMS has developed a national strategy for quality that includes 5 aims. Of these 5 aims, aim 1 speaks to behavioral health and opioids. Our goal for the 12th scope of work aim is to reduce opioid adverse events by 12.5%. The first step as we were developing the strategic plan was to do a SWOT analysis, looking at our strengths, weaknesses, opportunities, and threats. I've highlighted in yellow some of the themes that arose that allowed us to create a strategic goal. Our strategic goal is to develop a comprehensive program to support providers across the continuum of care with education, tools, resources, technical assistance, and aimed at promoting the principles of opioid stewardship as well as safe prescribing of opioids to decrease opioid-related adverse events by 12.5% by the calendar year 2024. Again, we don't want to eliminate opioids. There is a certain patient population that it's completely appropriate for, but we want to ensure we're prescribing them safely to truly the patients that need the most. The next step in our strategic plan was to create a strategy map. We narrowed it down to 4 domains. The first is financial. Considering all of the budget cuts at the federal level, we really have to be lean and we have to be very nimble in this project. We need to focus on maintaining the budget and really give and monitor the return on investment for CMS, looking very much at the cost for providing these services per provider that we've recruited. The next is our customer. That would be our providers. We want to meet them where they are because many of them have already started on this journey into opioid stewardship. So we want to make on-demand access to tools, resources, and education. We also want to create customized action plans that will allow them to continue the journey and reduce the opioid prescribing. Internally, we want to make sure that we work cross-department in collaboration. For example, we're really going to be working closely with IT to maximize our virtual platforms to be able to offer many of these tools and resources that are web-based, education via WebEx, and interactive dashboards that will allow our providers to look at their outcomes at any time. The last is growth. So this really speaks to our employees. We need to make sure they have the training, tools, and resources to be able to get their job done. So how are we going to monitor all this and making sure our action plan helps us succeed our strategic goal? We've created a balanced scorecard. And that really relates to the domains we find in our strategy map. For customer service, we want to make sure we're meeting the needs of our providers while also making sure our patients and families have what they need. Again, as I spoke with the financial performance, we have to keep a very close eye on that return on investment to make sure we are working lean and maximizing our reach with as little dollars as possible. In the next domain for internal business process, I just want to highlight we've actually selected 2 process measures as well as 2 outcomes measures. The process measures will allow us to monitor if those recruited providers are actually operationalizing our strategies, and the outcomes measures tell us if they're effective and we're reaching the desired outcomes. The last is learning and growth. And again, this focuses on our internal stakeholders and our staff. We want to make sure they're trained, they're not overloaded with too high of a number of providers in their assignment, and also employee satisfaction without their ability to give us feedback and also to feel engaged and empowered. We won't find more innovative ways to do things. With this balanced scorecard, we've created a dashboard of the key performance indicators. That dashboard will be reviewed weekly as a part of our management by objective model. We'll look at this at the level of executive management as well as on the department level to make sure we're keeping on track of our performance. The next piece of our strategic plan is our timeline for implementation. This will really show us where we're at using key milestones to make sure we're on target so that we reach the ultimate 12.5% goal by the end of our project. The green boxes will show you our communication strategy. It's really important that that messaging goes out consistently throughout the project internally using virtual communication boards, CEO town hall meetings, and also our weekly department meetings. Externally, we want to leverage things such as e-newsletters and e-blast so that we can continue advertising the tools, resources, and educational opportunities for our providers. You notice the timeline begins with the guiding team. We're really going to leverage that core group to be able to get the message and any trainings down to our frontline staff, as well, more importantly, to get the feedback from our providers. That's really going to be key. We also, you can see there's milestones along the way for recruitment, for developing tools and resources, as well as beginning the technical assistance and completion of the individualized action plans. We've also included on here the 3 learning and action network events that's required by the contract, last one of which is for sustainability and spread, so that we set our providers up to continue these improvements even after the end of the contract. So that's the end of my presentation. I'm happy to take any questions at this time. Thank you.